An RVU is America's solution to how to bill for medical services in the United States. It stands for Relative Value Unit, and it's how you determine how much work someone does in medicine. Who does more work? The dermatologist who saw 50 patients, or the surgeon that did 2 surgeries, or the psychiatrist who saw 8 patients throughout the day? It's hard to quantify all those things. So the solution we have is to make a fake currency, think of it like Cole's Cash, but for doctors, to have a centralized way to communicate doctor efforts. So if I generate 10 RVUs, that's a certain amount of basically tokens I can take to go cash out to Medicare, and Medicare will pay me back for that. But it gets more complicated because each specialty is paid out differently per RVU. So psychiatry gets about $56 per RVU, you see over here, but then neurosurgery gets about $80 per RVU. And this is usually fine because we're doing different things. I know that when I'm assessing someone for depression and prescribing antidepressant medications, I'm not doing brain surgery, and I understand that they may not be billed at the same rate and they live in different regions. But it does get weird when 2 specialties perform the same thing. For example, a labiaplasty could be performed by an OBGYN or by a plastic surgeon, but those 2 things are going to be billed at different rates of reimbursement, even though it's the same procedure. And all this is a bit opaque, so let me walk you through what an example would actually look like. In psychiatry, I might have a CPT code. Think of them as like a barcode that's assigned to the specific act the physician is doing. So whether it's psychotherapy or surgery or a biopsy procedure, everything that you can think of has a code. You can find an RVU code for someone who's bitten by a pig or injured due to crocheting. 9214 is a really common one. That's for a follow-up med management visit. I earn 1.92 RVUs, which if I wanted to take to Medicare, they would pay a psychiatrist a rate of $56 per RVU, so at 1.92 it's roughly 2, so about $110 per med management visit. Therapy has a different billing code. Simple patients, more complex patients all have different billing codes associated with them. Patients seen in the hospital have different billing codes, all for different amounts of RVUs. To give you more context, let's say we're doing something like surgery. So something like a partial liver resection, which is 39 RVUs times $62 per RVU, you're looking at like $2,000, $2,300 for a procedure. You can be like, oh wow, that's a lot more, but also a partial liver resection could take you all day, whereas like that 99214 code, that med management visit that I'm getting $110 for, that's a 30-minute appointment, and you can have 5, 6, 7 of those in a morning. And this is actually one of the biggest reasons why a lot of psychiatrists don't do therapy. If I do a 1-hour-long therapy session, I can bill it at the same rate or sometimes less than a 30-minute med management appointment. So if you wanted to stack your morning with 4 1-hour therapy visits or 8 30-minute med management visits, you can make a lot more money doing med management. Ultimately, though, within the system, anything that's procedural is going to generate more RVUs than anything that is cognitive or just like thinking about the patient. That's why ultimately surgical specialties are going to get paid a lot more than medical specialties. And something like infectious disease doesn't inherently have a ton of procedures in it, so they just don't have as many RVUs to bill for. But something like dermatology, where every single visit, if you did like a core needle biopsy or something, you can bill for a procedure and then generate a lot more money. Dermatologists can just churn out industrial amounts of RVUs because that's kind of how their specialty is set up. There's no one with a magic 8-ball who's saying, oh my gosh, like it's so much harder and more complex to be a dermatologist than an infectious disease doctor. It's just that the way the rules have been laid out, some specialties can reap and harvest RVUs and make a lot more money than others. The game supports procedures, and people that do procedures are going to get paid out. It does create some perverse incentives, though, because if you go see a doctor and they don't do a procedure on you or they don't offer you a procedure, they will bill less and they'll make less money than just doing a consultation. So it can get kind of strange. Like as much as people want to say they'll rely on their medical judgment and be unbiased, the fact of the day is you have several options for things you can do for your patient, and some of them pay more than others. That's going to introduce some differential bias into the equation. I think that's why it's important to highlight that surgeons that are really careful about who they choose to do surgery on are demonstrating how much they care about doing right by the patients. Also, I'm a trainee and I'm just getting introduced to billing codes, so I'm just trying to get used to like how to see this work that I saw as like purely academic and altruistic to now being like a business model where they're not just your patient but also your customer in a way. Like it changes the philosophy of things. Sometimes I kind of wish that I would just be salaried, and that though some people would argue that just being salaried would incentivize you to do less work, which I hope is not the case, because most physicians, I think, or would like to believe, got into it because they want to help people. I don't know. We'll see how the landscape continues to change.